not only are the stem cells the cells that make the cancer grow, but they're the cells that also make it spread, and they're also the cells that are resistant to therapy. So they really form a very difficult target to kill. And so I'd really been translating that type of work that we did with the normal cancers into the Fanconi situation, because we believe that the differences between the Fanconi cancers and the normal cancers are associated with the properties of the stem cells. And we were able to show 4 or 5 years ago that the Fanconi cancers, the stem cells behave a little differently, and this makes the tumors more aggressive. Now, we didn't know whether that was because they'd been around for some time, so we wanted to find out where they really started and what was happening at the beginning. So this grant was to take normal epithelium from the mouth and from skin and take the Fanconi gene out, which is what happens in the disease, and then look at the cells to see how they behave. And I think that's going to be really interesting, because that's going to give us a lot of new targets potentially for treating the cancers themselves. Well, I think it's clear from the work that's going on these days in cancer that if we're going to get better treatment for Fanconi patients, we have to target the stem cell fraction in the tumors. And I think that some of the research that we've done is useful, because it's allowed us to isolate the stem cells so we can study them separately, and we can see how they respond to different therapies, how they respond to radiation, how they respond to chemotherapies, and how they respond to other, what we call targeted therapies. Targeted therapies are going to be very useful for killing stem cells, I think, because, as I said earlier, the stem cells are resistant to radiation and chemotherapy. So we've got to find some other way to get at them. Now, because stem cells have different pathways and different control mechanisms, which are keeping them in division and keeping them immortal in some sense, okay? Those pathways are separate from the rest of the tissues, so they can be targeted. The problem with cancer therapy is that most of the cancer therapies which kill the cells themselves are also damaging the normal tissues. So if we can find a stem cell pathway which is unique to the stem cell, or at least more strongly represented in the stem cell, that can form a target which can kill the stem cells in the cancer without damaging the normal tissues, and that would be very useful indeed.